Thank you, Governor, and thank you all for your leadership. And I really want to say thank you for NGA as you have continued to push the leadership role of governors in this nation. And I don't think that there's any greater call for us today than to tackle this issue of addiction. I am so thrilled sitting here listening to your leadership and listening to the direction that you've already chosen to go and the ownership that you've taken for this challenge that is facing our nation. Because at Casey Family Programs, which is the sister foundation of Annie E. Casey, we believe that one of the greatest challenges facing this nation today is the erosion of hope in the lives of our citizens. And that many of the challenges that we're facing are directly connected to the lack of hope that some of our families are facing. But I heard something here today that I think we all need to hold on to. These are people. These are our people. And they need to know that we care about them. I was in New York City during the 80s when the crack epidemic hit. Unfortunately, we tried to punish people out of drug use. And we didn't see what someone said here today, which is this is a disease. Recovery is possible, but treatment is necessary. And the underlying point that I heard here today is that we're not just talking about individuals who are addicted to a substance. We're actually talking about sons and daughters and uncles and aunts and mothers and fathers and brothers and sisters. And for every addicted person that we will encounter, there's a family standing behind that addiction. There's a father who is afraid that his son is going to die. There's a brother who, as I had to do in 2010, who has to go and bury his deceased brother. There's a community that watched this young man or this young woman grow up expecting great things from them, that one day they were going to be the leaders that will replace you, who have to come face to face with the fact that that might not be possible. And so I stand here today to applaud you for your leadership, but I want to encourage you to keep reaching up, because the federal government has to step in and support you in what you're doing. But I also want to encourage you to reach down, because from your seat, you need to engage the mayors and the local city leaders who are responsible for these same citizens in those communities, and get them also on board with what you're trying to get done. Because as was said from this panel, we cannot do this alone. And we cannot do this from a single department or from the business sector can't do this by themselves. The elected governance sector can't do this by themselves. The not-for-profit sector, which I include faith-based in that, can't do it by themselves. We also need to engage philanthropy, who cannot do it by themselves. We can make grants, but we can't grant our way out of this. We've got to come together as one group, and that group has to include a fifth sector. And the fifth sector is the community. The community that surrounds these people, who touch them every day, who have changed their diapers. We need to engage in a way that says we cannot rest until this is over. And we cannot give up on a single soul, no matter how many times they relapse. But we need to understand that we can beat this. We have a history of winning. And this is no different. But we cannot give up. We cannot declare it done. We cannot say, well, we fixed this neighborhood and therefore we can use that money to go someplace else. We've got to rebuild from the ground up. And I'll give you two numbers. One is 25 minutes. Every 25 minutes, a baby is born in the U.S. who is suffering from withdrawal from opioids addiction. That means that during the time of this conversation, this very inspiring, very encouraging discussion, 3 babies have been born suffering from withdrawal from opioid. That means that by the time we finish this 3-day convening, 173 babies would have been born suffering from opioid withdrawal. Dramatizing how serious this is and how we cannot rest until we get all of the solutions and working for us, and that we can keep moving forward together. saving as many as we can, but understanding that the longer that we wait, the more casualties that we're going to experience. And the second number that I'll give you is 1/3. That number is significant. In 1999, there were 567,000 children in foster care across this country. Casey Family Programs, along with others, started an endeavor called Building Communities of Hope, which is an effort to change what is going on in communities so children don't have to come into foster care when their families face challenges, but that we can serve them at home. And from 1999 until 2012, there was a 30% reduction in the number of kids in foster care. It had gone from 567,000 children in foster care to about 390,000 children in foster care. From 2012 to today, that number has gone back up to over almost 430,000 children in foster care. It's heading in the wrong direction. And children who spend their lives in foster care have some of the worst life outcomes than any of our children in this nation, including those who are chronically poor. We must see the faces of these babies. And I encourage you to reach out to your other colleagues. Every governor should be in this room on this issue. And we need to make sure that the federal government is in it. And I will tell you, philanthropy is in on this issue. Casey Family Programs will be a resource. It doesn't cost any of your states anything. We bring the resources that we have gotten from the late Jim Casey, the founder of UPS, and we give them to your states. Right now, we work with every one of your child welfare agencies to make sure that we are not leaving any of our children on the playing field. We can't leave them behind because they need to be leading this charge as we go forward. And the challenge is for us to continue to remember that these are people. And that 1/3 number, 1/3 of all of the placements that were made in this last year, over 200,000 children coming into foster care. 1/3 of the reasons for removal on all the cases had parental substance abuse as a reason for removal. This epidemic is not just dealing with adults, it's also dealing with our babies. And I believe that working together, one of the quotes of the late Jim Casey, committed people working together can do anything. And so I was honored to be invited to say a few words to you today. But the one word that I want to say to you is that we will work with you, because this is a fight we have to win. Failure is not an option. Thank you for inviting me. Thank you for your leadership, and thank you for what you're doing for our children.